you get your test done, and God forbid you're positive. God forbid you're positive. My recommendation is that first you see a doctor, get their opinion. It is very, very important for you to get the opinion from a well-trained doctor who knows how to manage COVID. And it is very important that they may ask you to undergo some blood tests. If it is required, you please do it. Don't panic. COVID is very common now, and it is a problem which can be solved provided you get the medical help at a very early stage and follow all the instruction given by the doctors. Now, there is a possibility you may be asymptomatic. Then the doctors will tell you that stay at home. Yes, please stay at home. Isolate yourself. That's very, very important. Wear a mask and check your oxygen saturation every 6 hours with your own pulse oximeter. I expect every citizen of this country now to, at least every household, to have at least 1 or 2 pulse oximeters, which are freely available, and they're not very expensive. And believe me, they are very reliable. And check your oxygen saturation at least once in 6 hours. And after you check it, again walk for 6 minutes, and then again you check your oxygen saturation. If your oxygen saturation is staying above 94%, no problems. But if it is falling after the exercise, then you need to call your doctor. It's very, very important that you get the right treatment at the right time.
So there are 3 possible scenarios that can emerge from here. One is the fact that you are not sick so much that we don't expect you to recover at home, that the treatment can be started at home right away, and monitoring at home can be done, and you have given guidelines of what medicines to take, and the medicines will vary according to the need of the individual. That's why you need a doctor to understand your symptoms and your other comorbidities and other things, and then prescribe. So that is what we call home care or home quarantine. In case you do not have enough space in the house to isolate yourself, then we have quarantine centers where one can be admitted and care taken, like isolation there, and also your oxygen and all that can be measured there. So these are places where you can not only be, if you don't have isolation at home, but if you are mid-level symptoms, you can go, and all of our hospitals have established these facilities, quarantine facilities, in hotels or guest houses next to our hospital, where you will be monitored real time on a daily basis. If by perchance things deteriorate, we can always bring you into our hospital. That way the channel is clear that you do not seek a hospital admission if it is not necessary or out of panic. Let the doctor guide you where you belong according to all the questionnaire that you answered. So then if those are people who have drop in oxygen, the CT scan is showing high score, or we all feel that, look, and all the doctors have the protocols, that according to the protocol we feel that you have to be admitted, only then you should be brought into the hospital. So you take medicines like Faviflu, you take remdesivir, you take some of the other vitamins and all that you need, we prescribe. All those have been manufactured in India in enough quantity. Now, you may have heard there was a shortage of remdesivir available, so I want to address the fact, when do you need remdesivir? We have now made a protocol that remdesivir is to be given not to everybody who will test positive, and that misconception I would like to only the doctor will look at a set of test results and a set of symptoms which show that a person is experiencing a viral load which is giving them high fever. They are vulnerable population, like people who have liver disease, who have kidney disease, people who are on chemotherapy but from cancer, the highly diabetics, obese people. People who have BMI greater than 35 are the ones who are most vulnerable. And people who are showing signs of cough, fever, which is not responsive to other medicines. So in the first few days of the illness, if the doctor feels appropriate, only then remdesivir is to be given and not to be given to everybody. It is not a Ramban, and it is only effective in decreasing the viral load in the people who need it. That in any country, any part of the world, there is X amount of oxygen available as a as production. Today, we have enough oxygen if we try to use it judiciously. We don't want to waste oxygen. So the protocols for oxygen use and the response to what level we want the oxygenation in a patient to be, and the fact that I would like to inform the public also that if you don't need it, don't use it just for a security blanket. If you are not using it and you are walking around or eating or something, switch off the oxygen. We are giving the same advisory to doctors and to hospitals also, that judicious use of oxygen most definitely should be done, and any patient who needs it should get it. So wastage will only lead to depriving some people of this oxygen, which we as individuals, as citizens, have a collective responsibility that we do not want to get into that stage where we feel responsible for being selfish in wasting something and depriving somebody else. So, having given you that, there is good hope, but masking, of course, is your first duty. Wear it, distance yourself, and hand hygiene is every citizen's responsibility and the first line of defense and the most effective way of preventing the virus from spreading. So the bed situation in India, a lot of expansion of capacity has been done in the last year. Where also more capacity is to be added. But what I would like to communicate is, and appeal to people is, don't rush to the hospital just because you have tested positive. You will be taken care of or will be given beds if everybody participates responsibly in this and the doctor prescribes that, yes, it's time to bring you into the hospital. Same advice we are giving to all our doctors also, to take care of patients properly. When they need it, only then advise that they should come into the hospital. There is no such thing as preventive hospitalization. We should not do that. There is always a limited capacity, but we will cope. And you will appreciate that for the over last 15 months, the medical community, the health line workers, the frontline workers, we are all standing, fighting together this whole unfortunate event that has happened. And we need your help in reducing the burden, and we can do a much better job for you.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.